Hi, let's talk about the posterior compartment of the arm. The posterior compartment of the arm is far more parsimonious than the anterior compartment of the arm, for it's comprised of one large tripartite muscle. This muscle is the triceps, so three-headed brachii muscle of the arm, and two of its three heads are visible now. So we can see the lateral head as well as the long head of Triceps brachii. The medial head is deep, largely to the long head, but let's discuss what we can see here. So proximal to both of these, we can see the deltoid muscle, and we can see its origin from the spine of the scapula. We could see the infraspinatus muscles, and we can see teres minor and teres major muscles there. Our long head of Triceps brachii originates in the infraglenoid tubercle of the scapula. Our lateral head of Triceps brachii is going to originate in the posterior portion of the humerus superior to the radial groove. And they're going to come together in a common tendon here, and this is going to be joined by the medial head as well, to attach to the olecranon process of the ulna, that bone of the forearm. So when we look deep to this, so what we've done here is we've largely cut away what would be the long head of Triceps brachii. So we still have our lateral head there, and we can see deep to this long head the medial head of Triceps brachii. Together, these three heads, or this muscle, is quite a powerful extensor of the elbow joint, so it extends the forearm. And the long head, which we can't see here, is a weak extender and adductor of the shoulder joint, or the glenohumeral joint. While we're here, it probably bears mentioning. We can see a couple of things here with the muscles pushed away. So we can see the radial nerve here, and we can see so that's the radial nerve. And we can also see the deep artery of the arm. These bits of neurovasculature are associated with the radial groove of the humerus in this area, and the radial nerve is supplying all of the posterior compartments of the upper limb. So it supplies Triceps brachii as well as the posterior or extensor compartment of the forearm as well. Thank you very much.